If you have to see a doctor, do the numbers you get from test results look normal? But what normal means is that's the average of the population. If you look at rates of chronic conditions in the UK, which are people with long-term conditions now account for about 50% of all GP appointments, 64% of all outpatient appointments, and over 70% of all inpatient bed days. So the normal for people that see a doctor in the UK is having a chronic condition. In other words, if you are a Martian and you landed in the UK today, NHS stats say 67% of men and 60% of women are overweight or obese. So that will be normal. It's not optimal, but it's normal. So if you have set yourself a health goal, is it to have what is considered normal health, or are you aiming for optimal health? I help my clients to think about creating health, to look at the body as a whole system, to look at sleep, breathing, nutrition, movement, and mindset, to optimize the essential functions of our body to create health. By helping the people I work with improve their sleep quality and quantity, they get more deep sleep and REM sleep. They have better functional breathing so they don't get out of breath so quickly and can play with their kids and grandkids. We explore foods that aid their autoimmune system rather than create inflammation and fight against it. We discuss the most appropriate form of regular movement for their lives so they're not so prone to breaking bones if they fall down. And above all, to have the mindset of knowing they can take responsibility for their own health, be proactive about it, rather than what so many people do, which is to be reactive and wait until the pain or the tumour shows or receive that diagnosis. When you create health, often disease goes away as a side effect. Give me a call or send me a message to chat about my one-to-one coaching and online group workshops, which are a lot of fun. Please share this video with anyone that might find the content useful, and give the video a like, which helps it to be seen by more people. Thank you, and you might find one of these two videos useful.